Welcome to part 2 of my discussion with Dr. Evita Limon-Rocha. Today we're going to be discussing about cultivating hope, maintaining well-being, and dancing to the beat of your own drum. So join me, friends, in welcoming Dr. Evita Limon-Rocha. Welcome to the Becoming Latina Physicians podcast, a place where I share my journey to becoming a physician, as well as the stories of others in our community to help inspire, mentor, and equip current and future Latinas on their successful journey into medicine. I'm your host, Dr. Alanis, a board-certified diagnostic and interventional radiologist. Join me in our trailblazing community as we share stories, inspire, and mentor each other to thrive in medicine. Get ready to learn, grow, and become resilient, friends.
If you don't mind sharing something that was a good thing that came out of medicine and something bad. Like for me, the bad is the whole insurance, because I do procedures. And so when a procedure is denied and I have to do a peer-to-peer review, it's kind of like, oh my gosh, this is medicine. Like I need to prove to them that the procedure is indicated for this patient, but there's so much red tape and logistics. And then an ugly, like for me, maybe an ugly would have been when I was, in surgery and the surgeon basically just literally threw a piece of intestine at me because they were so frustrated with whatever was going on with their lives or whatever the situation was. But for me, that was an ugly, like, I'm trying to do my best here. I'm trying to be engaged. I'm trying to be involved and you're mistreating me. So can you share 3 stories that come to mind?
I love, and one of the things I love about the book Becoming is Michelle Obama talks about failure. And I really think that it's important for students to hear that we don't walk on water. We don't have these capes or special powers. I'm not going to move objects with my eyes. And so I think that definitely kind of in terms of training, there's been lots of different challenges. I think from kind of being in medical school. So my daughter was born my 4th year of medical school. And I was very strategic that when I wanted her to be born, because I wanted to kind of basically hide that I was a mom for interviews and for residency, because I didn't want, residency programs. I felt at that point in time, I was worried that they might kind of count against me. And so I was very intentional of when I had my daughter. And I think that it was hard. I felt very judged as a medical student being pregnant. So I think that was one thing that was challenging, because even by my own peers, I think I stood out as like, oh, there's the pregnant medical student. So it was very funny to me now that I think about it. I think that one of the things that I've learned is that you've got to do things that make sense to you on the timeline that makes sense to you. So as a 3rd year medical student, I remember attending kind of pulling me to the side and really going through my life, how I was going to be divorced, miserable with no children. And that was always something that I wanted, and really kind of went through. And actually it was 2 different occasions that male attendings kind of went through my life and basically were painting this really horrible picture for me. And I'm 3rd year, so I don't have much left to graduate medical school. And even after I was in my MPH year, another attending, really now that I was, I think at that point, probably 6 or 7 months pregnant, were telling me that really, I was going to be a mom. So there's no point for me to continue on this journey to medicine. And now that I think about it, I revisit those memories and I'm like, I'm almost done with my medical school. And you're advising me that I need to be a mom and give up my dream. So I remember those things, but I think what I always tell, and when I do presentations for students, I'm very open that I have 3 children, that in life, the things that mean them and that matter, you'll make time for those. And for me, it was, I have an amazing, loving husband, been a huge cheerleader, an amazing supporter throughout my applying to medical school, going to residency fellowship journey. We got married in medical school, and I knew that he and I wanted a family. And so we did. And students will ask me, well, is there a particular time? And I tell them, it's on your time, the best time that makes sense to you. Because in general, and I think this is one of the things that I've learned across time, because when I was a medical student, it felt like medicine was the hardest field of life and the hardest journey of life. But as I've known, most individuals, I would say, struggle in one way or another. A lot of jobs are very, very hard and challenging. You don't necessarily have to be a physician to have lots of challenges. And so I think that in terms of medicine, and ultimately you want to do something that's worthwhile, que vale la pena, and it's something that you feel like is meaningful to you. Medicine, of course, has been very meaningful to me. And I've done things that in ways that make sense to me. And I've been blessed with the support of a family, of familia, of mentors, and really my husband that has helped make it possible that I had my daughter in medical school and I had my sons during residency. So I think that because of that support, but definitely there's a lot of people that will tell you, no, this can't be done. But I think that that's where that mentorship is key. I think that I loved what you said, Lourdes, that and I tell students all the time, I'm like, I'm officially 5 years post-training, and I still need mentors. I still am growing. I still have lots of things to kind of be a better version, and not necessarily like in a negative way that I don't appreciate the milestones and the growth that I've had, but rather I think it's positive to have that growth mindset of lots to learn. I to learn from a lot of different people. Patients teach me in terms of how they experiences their challenges about their lives. I learn a lot all the time. I learn a lot from kind of individuals in all different areas, like the people selling flowers on the side of the road. I learn from them in terms of their strength, in terms of working hard to support their families. So I learn a lot, and I tell students to kind of be open to the knowledge that you're going to learn from different areas. And again, I will openly tell them, yes, the people that have told me, no, down the street, I'm probably down all the way an hour drive. But again, you always have to do things on your time that makes sense to you. And really, I think that one of the things that I appreciate, my mom has taught me many things. And one of the gifts that I have that's very special is it's this picture frame, and it's white picture frame, and it has black felt inside the picture frame and the little rhinestones in that picture frame. And when I got it, she gave it to me my first year of medical school, and that was my Christmas gift. And she said, Mija, life is beautiful, but if you focus on the darkness of night, you don't get a chance to see those beautiful stars. So Mija, don't forget, amongst everything that's happening, and as you study and as you're pursuing this career to be a doctor, that you focus on those stars. And so I think that a lot of times, yes, that there's a lot of challenges that we all face just living, but it's important to appreciate those small acts of kindness, those small gifts of friendship, that even after all these years, like it's just like yesterday, right? The gift that you have given me, this of friendship. And I think it's a really beautiful thing. And I don't forget that, right? I'm blessed because I know you and your strength, your journey.
And I feel the same way about you, Evita. I really do. I feel it sometimes, like, and I believe just like how you believe in the universe, they'll send you signs, it'll send different challenges, even though you feel like it's unfair. It's meant for a reason. And we may not know why that challenge or situation was placed before us, but maybe in a couple of years or next month or something, we'll realize that is why I went through all those trials and errors, those ups and downs, was to prepare me for the next steps in life. And I absolutely love that gift that your mom gave you. And I also wanted to share a story with you. Remember when we were in medical school, and I think, I don't remember exactly where, but you used to live in these apartments somewhere near Brentwood. I remember for some reason I went to your house and Amy was supposed to meet up with us, and Amy had her baby and her stroller at this point. And I don't know if you were pregnant or not at this point, because for me, although other people, how you mentioned, oh my gosh, there's that medical student that's pregnant. For me, it's like, you're Evita, you're a medical student, you're going to be a doctor, and you're going to be a mom. Like, she can be whatever she wants. She's going to be it all. But I remember going to your house, and I remember seeing a psalm, and I can't think of it right off the top of my head right now, but basically it said something like, God will never let you fail. Whatever he puts in your path is for a reason. And I remember seeing that, and I said, oh my gosh, like I'm going to Google that, and I Googled it, and then I kept it as a screen for my phone. And that got me through fellowship and a lot of things, because I always thought, okay, no matter how hard I feel it is right now, life, it feels like I can't breathe. God, the universe is with me, and there's a reason why I'm here. And he would never put me in a situation where he didn't think I was going to succeed. I always think about you because that really carried me through a lot of the training. So thank you for having that in your house and for sharing
No,
with
it's
me.
true. And I think that as long as you're trying to do good things, the universe will work with you to kind of guide you in directions that you didn't know possible. And again, that's the beauty of MEP and those individuals that can point you in directions that you didn't even consider. So when the times are tough, they can help you kind of navigate how to get through those really difficult times. To this day, I am, and I will be ever in gratitude of my program director, Dr. Bridget Bailey. She is probably one of the greatest teachers I've ever come across. And it's funny because I'll reflect on my day, a lot of reflecting, and I encourage students and scholars and everybody just to take a moment to be with themselves and just kind of be present kind of in where they are. Take a body scan in terms of where they're holding tension and stress. Also reflect on that journey that they have kind of on a specific moment. And then kind of say, wow, look at how strong I am. Look at all the things that I've done, and then reflect on that mission of, and this is where I'm going. I really try to do that. And ever so often I'll think of something that I'm just like, wow, realize that she was teaching me this. And I still to this day will kind of, wow, this is another thing she was teaching. I didn't realize that she was teaching. But with that, I feel like she also got me through fellowship. So I think, right in between my first and second year. So child psychiatry is a 2-year fellowship. And I was in Texas because Texas is where Dr. Bridget Bailey is. And so I wanted to be out in Texas. And so my dad ended up in the ICU. And so she made it happen. I was like, it was Saturday, and I was like, Dr. Bailey, I'm jumping on a plane. I'm going to Mexico, and my dad needs me. She had the service covered in the hospital. She made sure my patients were going to be taken care of, and she was like, sounds good. Call me when you land. And really moved mountains for me to be able to finish fellowship, and kind of made where if I needed to be somewhere, like made sure she supported me in that. And so that's why I tell students it's so important to have mentors in your life that on the times that, and I sincerely at that point in time thought I'm not going to end up finishing fellowship. It's just not, I don't see how it's possible, but she made it happen. And it's interestingly enough, as a child psychiatrist, she's very smart, and she figured out a way so that I could, because that whole experience in itself was very traumatic. And so she had me under the guise of, I was writing for a scholarly journal about that experience to share with kind of the community, the lessons that I learned. So she had attending, so someone had already completed their training, worked through that exercise with me as I wrote, and I kind of wrote this essay, which was going to nowhere. She had the brilliance to say that it was pretty horrible. Let me help my fellow process. And so she skillfully and provided the support, because I had provided kind of the safety to be able to do that, created the space to be able to do that. And so again, you got to prove those people that are cheering you on right, and have faith that they're seeing some really wonderful that we may not necessarily be able to see just yet, but have faith that what they're seeing is true and accurate. And that's something still I'm learning to this day. Kind of when someone, to take a compliment, I'm still work in progress. When someone tells me something, I'm like, all right, I'm going to take that. I'm just going to take that. I'm not going to do anything with that. I'm just going to take that. And I tell, because I want to know that, again, that growth and like we're always kind of growing and changing and shifting, and that's okay. It's a good thing. It's not a bad thing to be kind of continuing to say, I'm still growing. I'm going to be a better version tomorrow than I was today. And hopefully, like, from that, better.
There you go. I love it. I love it, Evita. Anything else that you wanted to talk about today?
So I think one of the things is that I want students to always know that they matter. And so sometimes it's hard to come up to individuals that we feel have walk on water and are incredible. So I always tell students, if you feel nervous, superhero pose, arms on your waist, and go do it anyway. And then I always remind them Bravery doesn't mean that we aren't brave. That means that we do things, and even though we're afraid, we're saying, yeah, I'm afraid, I'm worried, I'm shaking in my boots, but I'm going to do it anyway. So don't let kind of fear stop you from doing things that are important. Reach out to those mentors. I think that the other thing I like to share with students is the expert at once was a beginner, right? So we all fell, scraped our knees, knocked ourselves like against the walls multitude of times. And so definitely when you see these amazing individuals, I get starstruck too. So if I see Dr. Ramo, Dr. David Hayes Bautista, I still get starstruck. And or Dr. Flores, Kathy Flores, like I still get starstruck. So, but I think that it's important to say that, hey, there's this journey that they've been growing, and it's taken many years to get to where they are today. I will say that explore psychiatry, explore the behavioral health field, because we need you desperately. Your comunidad desperately, your community desperately needs you to consider it. And then if you can consider child psychiatry, even better. I try to live a life with purpose. And my purpose and meaning, kind of if I could summarize it in one word, would be service. And so I think that if you can kind of keep where your values are, that kind of those goals moving forward. There's another really good book, Man's Search for Meaning. It's a Jewish psychiatrist and went to the concentration camps. And what got him through that experience and those moments was that he was going to write this book, and his theories related to hope and meaning and being incredibly powerful. And that's another reason why I feel like vision is so important, because we know that having hope can lead us through difficult times. It's a marker if we're not doing well, if we don't have that hope. So again, that's why it's important to keep it central to you for your well-being as well. And then the other thing too is that you got to take care of you. If you don't take care of you, then those beautiful missions, everything that you want to do in this world and what the world needs from you won't happen. So at every single moment, you have to be an advocate for yourself and really kind of know and keep kind of in touch with yourself. So that's why I take those little moments and I do these body scans, and I kind of say, okay, where is the tension? And really work hard. Okay, am I sleeping? Am I drinking enough water? Am I exercising? So movement is part of every single day. A day does not pass by where I'm not moving in one way or another. Peloton, I know we're both into Peloton. So I think for me, movement is medicine. It's a celebration of what my body can do and how amazing it is. It is never a punishment. It is a celebration, and it's good for my mental health. And that's why I exercise, because it's good for my mental health. I always tell students and scholars that really invest and really be cognizant every moment, every day of what it is that keeps you healthy, and make sure that you're doing the things that keep you healthy. Don't let that out the window. Keep that really present to you, because we need you. We need you healthy. We need you strong. And if you're not okay, then please don't feel afraid to get help. That's
Yes, I will say that I agree with everything Evita has shared with us, and health definitely comes first, because I can tell you personally, I put myself last for a very long time. I'm getting better, but it did take a toll on me, on my body, on my mental health. So listen to Evita, and since I've known her, I know she is always on top of that. And I remember he would run every day, run outside, run on a track, do something physical every day. And for me, I never understood that. I never understood that until now. So please do yourself a favor, for all those that are studying for the MCAT, for all those that are sitting for their boards, for all those taking their steps, remember your health comes first. Your mental health comes first. Take care of yourself, because if you don't take care of yourself, you can't take care of others. It's so important. So thank you for sharing that. That actually is a very important point. And also, don't be embarrassed. If you need help, you are considering reaching out to a therapist, a psychiatrist, just even asking questions, do it. Do it. Do not be embarrassed. I think a lot of us, especially in our culture, we get embarrassed because we don't want people to know. We don't want people to know that we have a therapist. We don't, our aunt's going to find out, and then it's going to be chisme, gossip, and everybody's going to find out about your business. But the most important thing is it is private with people. but it's something that if you're willing to explore, it'll help you.
Yeah, I agree. And then there was one thing else that I remembered that I wanted to share in terms of, and this, I love Vivo. And I love the little girl from Vivo because she's like really embraces kind of who she is and dances to the beat of her own drum. So kind of trying to fit in with everyone else was like the most boring kind of times of my life. So I always invite students and scholars to kind of dance to the beat of their own drum if they want a cute little movie. Vivo is a cute little movie, and to embrace kind of who they are. And definitely un placer with this. And just like, it's like time never passes with you, and that's the beauty of our friendship. So, te agradezco mucho. I appreciate you greatly.
Likewise, Evita. And for all of those that are listening, medicine will take you on different paths, right, Evita? You think you're going to start on one path and eventually end up somewhere else, and it's a journey. So remember that. And you're going to make lifelong friends, just like I have in Evita. And, the great thing about it is it's like a sisterhood in a way, or brotherhood, whatever you want to call it, because we both, even though we weren't in the exact same situations, we both went through medical school and the training and all the good, the bad, and the ugly. We have that understanding. But also, I feel like even if time goes on and we don't talk on the phone or we don't see each other in person, we have that underlying friendship, and it's an honor to call you mi amiga. Well, thank you, Evita, so much for joining me on this podcast.
Thank you for tuning in to the Becoming Latina Physicians podcast, your prescription for inspiration. Remember, your journey in medicine is not just about becoming a doctor. It's about the journey and the person you become while empowering others along the way. If you enjoyed this episode, be sure to subscribe at Spotify, Apple Podcast, or wherever you get your podcast. And remember to share this with others who need to hear this message. Until next time, keep shining bright. See you at our next appointment.